Welcome to Ramblings of a Madman. Today I'm going to ramble on about a topic that is still there even we say that our society is developed. It is universal healthcare. It is a topic that some people talk negatively and others talk about it positively. Before getting into the social dynamics, whether it is positive or not to the society that we live in, we have to consider the fundamental why humanity is requesting universal healthcare. Because as humans, the right to live is the most fundamental, important right there is, because that divides humans from other animals. It gives importance towards human lives. It gives importance towards society. It gives importance towards the development and to show that we are a better society than before. And we can take it in another way. If you are a religious person, whatever your religion is, it is the common notion that human lives matter. And if you are an atheist, the right thing to believe is human rights, meaning that the life of a human is valuable more than anything. So, in that sense, that humans cannot argue against this universal healthcare debate, because we people, the society, calls for this universal healthcare to save lives. But there are pros and cons, as I said before, and there are debates going on depending on the economy. But first, I talked about these aspects as human rights. As humans, the human nature supports this notion. Think about it. Mostly people who got severely sick would understand this. Most of the countries in the world have different programs in supporting these people, but still the economic strain to personal life as well as the family, the mental strain that there is immense. It is very hard to imagine that situation, and as humans, as the core nature of humans, we try to give a lending hand. Let's first look at the cons of having a universal healthcare system, which some might say we can't just say that there are cons and leave universal healthcare aside and move forward. But there are some important facts to address, and resolving these matters may help to promote universal healthcare more and more. Well, the number one negative aspect of free healthcare or universal healthcare, whatever the topic that is used, is the payments have to be done by all people. When saying the whole all people. It is mostly in the form of taxes in a society, and it is safe to say majority of the people in a society is not sick. And the question can be asked, why are we paying for other people's medical bills? This is a valid point under the economic system that there is. But think about it for a moment. If something tragic happens to you or anybody who you love, and if money becomes an issue between life and death, is that the society that we want to live in? You may not know the people, but it is your countrymen that you are spending. There are many ways that you can justify this spending. One of the ways is because everybody is chipping in through taxes. The amount of the amount of money that you have to put in is very small, and there are economic benefits to the society as well, because a healthy society is a fully functional, efficient society. That itself is a good investment, and to create a efficient, healthy society, tax can be put on. It's same as creating roads to have a good transportation system in a society. But end of the day, the real reason comes that it will only feel when it happens to you personally or to your loved one person, and I don't wish that happening to anyone, but this is the truth. So if somebody comes up with this particular example where why should I pay for another person's bill, just be open and talk to people, listen to their stories, and see the horror, and understand that you are lucky that you haven't gone through that. But as a human being, it's your responsibility to lend the helping hand to that person by a small amount of tax. The next negative is, of course, the human nature itself coming into action. That is, with free medication in a universal healthcare system, people will tend not to look after their health. This is true, but in another way, severe conditions come to people even if they take care of themselves. Think about it for a moment. People don't get cancer on purpose, and there are many types of severe conditions that people get without their knowledge. If they know how to stop it, they will. And freakish accidents happen all the time that will break people in half, and these things are not inflicted by themselves. Of course, when they say that people will take less care of their body, it is more towards people going into drinking, smoking, and that sort of a way. Even taking in harmful drugs can be added to this list, and there are workarounds behind this. Reckless Knowingly living recklessly, it can be sought out by simply by saying people who have done excessive drinking and sicknesses that come from excessive drinking, smoking, or drugs have to pay their full dues. This will completely eliminate the this no con that is there, that or the notion that is there, that if in a universal healthcare system that people will be reckless about their health. Think for a moment. Being sick is not fun, it is painful, and simply coming up with the notion that people will be less considerate about their health is a bit of an overstatement in that retrospect. But but this complaint of people may being reckless because of free healthcare or universal healthcare may also help the first argument that it's going to be a financial burden on the economic system. But all and all together, nobody wants to get sick. That is a hard truth, and it is very hard to say that giving free healthcare will make people reckless and want to suffer. That statement itself sounds ridiculous to the human ear because it doesn't make any sense. No human being want to get sick and suffer. So in that way, that con is actually one without any backing up. Apart from people saying that I don't want to pay for other people's health, and basically saying that people will be reckless when coming into health, let's get into proper problems that there is in the world. Because rather more than not only developed countries adapted this universal health system, even developing countries also step into this because of different reasons. And main thing that comes to mind is the humanity, to protect humanity, human lives, human rights itself. So one of the things that is that there will be a long line when coming into surgeries and things like that, because universal healthcare will give every person access to all benefits from healthcare, meaning that there will be more surgeries, more scans that will take place. This will make a little bit of a queue, but in the long term, I think by the increase of technology and the facilities itself, this issue can be taken down. The other one is lack of funding will be there and healthcare systems will fall apart. This can be true because whatever said and done, this could be a little bit of a strain for economies, especially for developing economies. And to maintain a proper healthcare system, it costs significantly, because healthcare is a subject that demands purity and proper well-being of itself. So maintaining hospitals, theaters, and everything from surgical masks to equipment to hospital beds, to maintaining those sanitation in these buildings, everything will cost a buck, and that is a real concern, that is a real con, because for developing countries this could be a stress to the economy. So to promote a system like this, the world should come in hand to facilitate these situations actually. But if things are done right, without corruption and without any other disturbances from environmental disasters or wars or any destabilization of governments, development will be inevitable, and alongside societal and economic development, hospitals will develop as well in any country. That will eliminate little by little, but This problem, not having proper facilities and not having proper standards and having economic strain on third world economies, uh, due due to universal healthcare, is a real thing. But the point that the people of countries that use healthcare as economic sense, in an economic sense, well, this is United States comes into mind. That is the example when coming into that. And even third world countries will not give up on universal healthcare because they see more positives to the society rather than negatives. So being the world's most powerful economy, will this really affect? Well, that's a talk to another day. I was just discussing the cons of having universal health care. So the third one is the one that will create stress on the healthcare system by not having proper standards. Then it will have impact on the economy, and there will be long waiting periods when coming into surgery. Overall quality will go down. The third fact is the main problem with universal healthcare. It's a practical problem, it is an existing problem, but the world, the societies, the countries, even third world countries have shown that this can overcome step by step. To overcome these problems, some countries have put forward hybrid systems as well. But before going into that subject overall, how to approach this system, let's look at the advantages of having this system in the first place. Number one will be lower healthcare cost. Whatever said and done, because of universal healthcare, prices will stay in stable conditions, and that will help people who need of healthcare to access healthcare, as well as everybody will have a chance, a fighting chance to live another day. The cost will be low, and that will impact the economy itself. Lesser spending for healthcare means that people can use that money to spend elsewhere in the economy, and the economy will have a chance to vibrantly grow. Or otherwise people will get stuck in debt and loans, to pay their medical bills, and the economy will stuck in a place because people will only spend in the healthcare sector to live. Let me give you an example where this universal healthcare is needed. Think of a person who's working hourly in a factory, and if that person gets sick, then they cannot attend to their workplace, meaning that the way of income will go away. Now think, this person needed to do some expensive surgery. How can that person afford it? Without going to work, they will not get paid, and not getting paid means that is the I don't know, the rest of it is a dark side, if you see, oh, if this is this and eventually death, is that the answer? It is a dark thing to think about, but it is the reality. How many people do you know who goes to work even being sick, because they have to go to work to afford their medication, or that's the only choice? So this is a problem that there is, and if that burden is not there, after that, think about a universal healthcare system where that worker can go and access medication for free, get the surgery done, and go back to work and help the economy to grow. That would be the proper thing to think about. That would be the long term solution. That would be the long term thinking of a human being there, because that will have the humanity part to it, as well as the intellectual look at the overall economy. So free health care will give that option. Alongside, free healthcare will lower administrative cost. This is something that is not needed for a person who's sick. This will be additional value adding to the bill, and eliminating this would be even eliminating that small part would help benefit that person who's in need a lot. Then we have to come into another sensitive part, a sensitive advantage. It is children's healthcare. Families that have children are basically starting in their life. Maybe they haven't still got promoted in their jobs. Maybe there are a couple of small children and they have to spend for their education and their welfare as well. On top of that, if a child comes up with a chronic disease, is the if they will not be able to afford medical bills without going into debt, and that is a big problem. That will be additional strain on the society as well as the economy when we have. So that means this has a lot of advantages. To sum up the advantages of having a free healthcare or universal healthcare, whatever you want to call it, let's look at the societal aspect of it. People will have the relief of not having to stress over finding money when they get sick to treat it. Rather, they can attend to the medical institution that they need to go and take proper medical care. They, in a societal level, in a human level, this would be immense. Think of the smallest unit of the society, the family. The parents will not need to stress over finding money to treat their children. They can just concentrate on getting their children back to good health. Even the same applies to grandparents. People people in a society, when people get sick or get into an accident or whatever, it's not a positive thing for a human being. It will impact in a negative way. And if a society is putting the burden of money on top of the burden of being sick and being disabled on that human being, in that is unacceptable, isn't it? You have to think it in a way that, what if this happens to me? And I think the biggest advantage in a society level for humanity itself is that when a person is down because of a sickness or getting injured, right, that person should not be battered by financial problems as well. So in a humanity level, universal, this is in a humanity level, as in the society as a whole, the good and the bad. Even in a religious level, even if you're an atheist or not, or if you have a specific religion, there's no religion that says no to the concept of universal healthcare, because it is giving hand, helping another human being, and that is the most important primal things in humanity, in religions, in any way that you want to take it. Leaving the societal part aside, let's look at the economic benefits of it. So as I told you, we in the when you take in pros and cons, in the cons we talk about the impact to the economy through this, but there is the other side of this topic, which it will benefit the economy. How, you may ask? It is simply by people spending less money on their medication, means people will spend more money in other parts of the economy. This is one of the advantages, because if people start to spend only for medication, or they have to take loans and go into debt because of medication, because of medical expenses, that means that person will not contribute to the economy in other ways, basic for it, like the other branches of the economy. the it then that particular person will not have money to maybe go to a restaurant and eat, go buy some good clothes, pay rent. These are all practical things that is needed to be considered. So rather than trying to turn one cog of the economy by funding only healthcare, by giving bills that cannot afford, what about let that person, and let's support that person's let's support that person economy wise in medication, so he can support the other cogs, vital cogs of the economy as well. This is part 1. Part 2 is, of course, a sick person is an inactive person. That means cannot go to work and cannot do their functions to the society, to the economy, and that means the value of that economy wise is of a person will drop. That person is not an efficient person. A sick person is not a productive person. So by helping that person to get well quickly without bothering him the economy aspects of it, because simply there are far too many examples where people don't get medication and because of the cost of it, right? So I think if somebody comes and say oh, like people can like afford, or I have seen sick people going to work, there's no problem. Yes, sick people go to work and try to get some earning because they cannot afford the medication. Think of a scenario like this: a person who cannot afford got sick, who cannot afford medication got sick, and even now he have to spend for medication, he cannot pay rent, and he is unproductive, he cannot go to work. But if he can get free medication or universal health care, then that person can get well soon and go to work, get productive, and start producing money by working. Then there itself it helps the economy. So these are the two sides of universal healthcare. Now let's talk about the world and how the world have embraced this. The whole world mostly embraces universal healthcare. Some look at a totally free option. The most extreme of it is through taxation. The whole society, the whole country funds the medical care system, and there are systems, hybrid systems, where there is universal health care which is totally free, and for people who can pay for their medication, there are private sectors as well. Then there are insurance schemes, government insurance or private insurance, where uh, uh, there will be a universal standard helping in the affordability of that insurance. Then there are rules and regulations put behalf of promoting universal healthcare. uh, People who, companies and institutions who are trying to get more money out of patients, that can be stopped. So there are different options that can be used. If you look at uh, YouTube or look at podcast, people, the main battleground of this universal healthcare versus the the commercial healthcare, the battleground is USA. Whether you like it or not, this topic, it have to be talked because of the situation. The facts and figures, maybe a lot of people have heard and seen. I think this have to be disclosed. Me myself is not a statesman. I'm not from United States. I don't see a positive nature in the system in United States, because the country I am from supports universal healthcare, and growing up in that system, reaping the benefits of that system, really opened my eyes for the importance of it. And living through that, I've seen it, and then seen the situation in commercializing medicine, commercializing healthcare, and seeing the numbers, the 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 sheer cost of even the smallest things. Just it's staggering, because let's face it, we don't live in a equal world economy wise. We live in a world where there are rich and the poor, but we all agree that human life matters, and the ability to live freely, and the ability to live itself is the main human right. That is our fundamental values. But in a system where the healthcare is totally commercialized and driven on profits itself, and there's no way of controlling, in economics come into play. And economics doesn't have a soul. It's all based on numbers and logics. Society, humanity is based on soul and thinking from the heart. So this battle, the battleground is in USA, and this will be a thing that will be talked in the future for ages to come, to find the right solution. We say as a society that we are in a developed state. Democracy itself, human rights itself, peace itself is in the highest level compared to the past. Even healthcare has reached its bounds that beyond imagination, and it will keep, the quality will keep increasing. And in a world like that, we are still having these primal debates. But there might be things that I don't, that's why I disclose that I am not from a background to understand commercial healthcare properly, but this is the way I see it. And looking at in a humane level, or looking at from a religious level, looking even as, if you're an atheist, if you look it in a humane level, and if you're even a religious, a hardcore religious person, if you look at it from any kind of religion, universal health care is the answer. But if you look at from a economic level, uh, then it is the commercial healthcare is the answer. But then again, if you look at a democratic level, a liberal level, where human rights matter the most, freedom of the human, the freedom of the individual, the freedom of the individual to live matters, then again universal healthcare comes into play. So it's a battle of two giant proportions, where the the main pillars of the civilization of humanity right now is trying to figure out what is best for humanity, it seems. I have been rambling on for a long time now. It is a difficult topic. There's no answers, but I think it's something that people should talk about and understand, at least keep in their back of their heads. It's because it is a thing, one day or another will affect somebody you know, or even you. Though it is a scary thing to think about, it is the truth in the world we live in. So thank you very much for listening. In this pandemic era, I wish you all the very best of health. Thank you very much. Ayubowan.